This is Dr. Ben Pearl of Fit Foot U. So today we're going to do a common thing that we see in a podiatry office, which is plantar warts. It's a version of HPV. It's not the sexually transmitted type. It's by contact, so it's a different strain of the HPV virus, which is why they're so difficult to get rid of. So we've tried a couple laser techniques with the ones that we have here. We've got two, and we're getting set up for an excision today because frankly, patients get frustrated. They want to get this finally done. I like to try to at least weaken the wart first, so we've done some acid and some preliminary things, and now we're going to set up for the excision. So what we're going to do is we're going to prep this with iodine. We've already pre-numbed it, and then we're going to come in 10 blade. It's the smallest blade that we have in a standard surgical knife, and we're just going to circumferentiate the area, just circle it out, and you got to go a little bit around because the virus tends to lie dormant in the area around the center part. And that center part, those little dots, I don't know if they're showing up on the video, but those little dots are actually the vascular elements of the wart. Now this will bleed a little bit, okay, because again, it's a very vascular lesion, so we're going to get the bigger one out first. We're ready to get out, and we're going to take that plug in a moment. We've got it all but removed, and then we've got a little one right here at the distal end of the first toe. It's about 2 or 3 millimeters, and again, just a little center area. I call them pepper spots. Those are the capillaries that nourish the wart and hijack our body, those capillaries, because they go in like a spider web and they keep nourishing the wart so that it can live. So what we try to do when we're doing things like lasers, we try to choke off that blood supply. So now we're just going to bluntly dissect so we get any of the area, and we're going to finish with a little cautery, which is going to be with phenol. Zoraida is going to bring us a couple phenols. Zoraida, if you want to grab a couple sticks, please. Shut down. We have a couple phenol Q-tips. We're going to just cauterize the area. This is a chemical cautery. It just helps to clot up, and it also helps to kill any viral cells that are still present within the wound of what we just excavated here. Okay, and then we're going to get ready for a dressing and wrap this up. Just make sure we got the whole edge involved here. I'm going to do one more once over and make sure that there's no elements left. Yep. Okay. Now what I'm going to choose to wrap this up with, we're just going to use straight gauze dressing with a little bit of iodine disinfection. And then we're going to wrap it up with we need compression on this because, again, the wart is a very vascular lesion. So we've got to have some good compression to clot the area that we've just removed the wart. Okay, so we'll get this going. Here. We usually use another wrap called cling. This will help give some mild compression, but also just another layer of gauze on the area. Now, right after this, the key, and I tell this to all my patients so you don't get a lot of swelling, is to keep this elevated. You do not want to be walking around doing errands because that can lead to more blood, more swelling, and potentially infection. So anything that you do that is not optimum, especially in the direct context right after you do a relatively innocuous surgical procedure, but still you got to treat it as if you're doing a big surgery, because you don't want something minor to turn into something major when you don't follow the protocols of just good common sense with taking it easy, keeping it elevated. Just doing a little gauntlet dressing so this holds on a little bit better. And then we're going to close with something called Coban, which is just a compression dressing on this. What I typically do is I follow up in about 2 weeks, make sure that everything is healing fine. In this case, there are also, and we can pan in to the warts on the other side there. We're going to end up doing those on another day, so he's got one good foot to walk on. And we're just going to finish the dressing. We always go distal to proximal on a compression dressing to get the blood going towards the heart. This will require a little bit bigger, generous shoe, either a post-op shoe or a generous slipper, so that there's enough room. You put a standard shoe on, and it's going to be just a little bit too much. Okay, just make sure we're good here. We're going to do a finishing strip here just to hold this inner space area. And then we're done. So we've got our wart excision with a nice compression dressing. And then these can come back even after sometimes excision, but what we'll do is we'll be mindful of any early signs. We'll end up using some type of antiviral. One that we commonly use is called 5-FU or Effudex. Till next time, this is Dr. Ben Pearl with